and welcome to Healthy Living, the program where we bring you vital information on health and wellness. I'm Aisha, Salihu, and today we're taking a crucial topic, managing sickle cell disease through increased adoption of hydroxyurea right here in Nigeria. Sickle cell disease is a genetic disorder that affects many individuals across the country. Today we'll explore the potential of hydroxyurea as a management intervention, shedding light on various aspects from the efforts of experts to the experiences of those who live with the condition. Let's begin by discussing the efforts of the Center of Excellence for Sickle Cell Disease Research and Training in Abuja to uncover how they contribute to the management of sickle cell disease. Professor Biageli Nodu at the University of Abuja, who is a director from the Center of Excellence for Sickle Cell Disease Research and Training, has more insights.
To know about sickle cell disease, because it is a disease that is in high prevalence in Nigeria. That is, almost every family is touched by it. We have more than 4 million young children, babies being born with sickle cell disease, and we have over 40 million individuals, carriers in Nigeria, that when they marry each other, when the carriers marry each other, they can potentially have babies with sickle cell disease. So it's a ticking time bomb. And that means that it's very important for each person to know his or her genotype right from childhood, so that before they get into serious relationships, they will have the option not to go along and produce more babies with sickle cell disease. Because with each pregnancy, for a couple, carrier couple, there is a 1 in 4 chance that they can actually have a baby with sickle cell disease, and that is regardless of the outcome of previous pregnancies. But having said that, sickle cell disease is actually a disease of ignorance, because we have found out about this disease for over 100 years, and it's completely preventable by carriers not marrying each other. So why are people still having it? One, because they don't know that they are carriers. And then secondly, when they know, they don't know the importance or the gravity of disease severity, just how ill someone can be from having sickle cell disease. They don't know that this disease can impact them economically as a family. Just the wear and tear and the many repeated hospital visits. And they don't know that this can take emotional toll on the psyche of a patient. The pain that you cannot predict when it will come. The pain that does not go away. Pain that is described as being worse than labor pain. Pain that can take several days to resolve. Pain that just comes unannounced and disrupts your life. And then the many complications that come as a result of sickle cell disease. So when I say that it's a disease of ignorance, people also don't know that you can detect patients with sickle cell disease even from birth. So I'm sure that people don't know that we have a newborn screening program in the FCT that has been there for the past 4 years, where you can go to 24 primary healthcare centers within and get a free genotype test. And it's not only you getting a test, we follow you up and we give you interventions, drugs to prevent you from having an. But more than the drugs, we train you on how to look after the mothers, on how to look after the babies, so that they are not always falling ill. And then people don't know that there is a disease-modifying treatment, which is why we are here today. This disease modifier is hydroxyurea. It's been in existence for over 30 years. Yes, yet in our registry of patients with sickle cell disease that we have from all over the country, over 9,000 patients, only 13% of individuals with sickle cell disease are taking the hydroxyurea. This is something that will reduce the frequency of pain crises, help your hemoglobin, help reduce the infection rate, and can really help people to live healthier lives. It is very accessible and it's affordable. That is why at the back of this paper, this is managing This is about Hydroxyurea by ASH, American Society. But at the back of it, you see that there's a Nigerian company called Bond Chemical Industry that has been making Hydroxyurea for many years. Cheap, affordable. It's called Oxyurea, and it's cheap, it's affordable. So it costs way less to use this than to be having frequent blood transfusions. I heard the best news ever, just in that hall today. And that is that patients with sickle cell disease can have access to health insurance as a vulnerable population. I made this request in 2012 to the Federal Ministry of Health, and I'm delighted that it's being done now. That means they can register, government will part fund them, and they can access health care. You understand? This is amazing. This is great. This is like the best news I've ever had. So I'm really delighted. Apart from that, education is key. Knowing what brings on a crisis, health education. And that's why we say the health maintenance is very important. Knowing how to drink a lot of water, how to eat well, how to pace yourself, how to take prophylaxis for infection, how to take anti-malaria, you understand, treatment. All of those things can help someone not to be having crisis all the time. And then how to come to the clinic for health maintenance and how to take the drugs that are available. So that's what we are here for. We are here for training. We are here for research, to find better and cheaper ways, cheaper treatments, better diagnostic methods. Implementation research is when you see evidence-based interventions, and then you can expand it so that more people will have access to it. We are doing implementation science research on ways, cost-effective ways of diagnosis, screening. So we are doing that. And then we are now doing implementation science. How can we upscale this treatment that we know works? How can we make more people have access to it? So that's what we are doing. And then we are training people. So this year at CESTA is the Center of Excellence for Sickle Cell Disease Research and Training. We want to focus on training the community healthcare extension workers, the primary providers, so that they will know, they will not be afraid. They will know what to do and they can provide that care. Because we are in the teaching hospital. And when we have these mothers whose babies have sickle cell, we say they should come to the pediatric. They say, no, it's too far. So we want to listen to them. I want to go to the healthcare center, primary, near to them, so that they can just come there. They'll receive their health maintenance, you understand. And then we strengthen the referral processes. So every child that we have with sickle cell, we give them the card for the teaching hospital. You understand? And then we give them the number of the nurses, right? And then we link them to care at the primary health care center. So if there's a problem in an emergency, they can go. They don't have to go and get a card. And we pay for these things. So this is what we are doing. So ignorance has been a problem. But as we talk with you and we work with you as important stakeholders, we know that you help us to get the message out so that our people can have. And we have a ton of materials at our website and also at the website of the Sickle Cell Support Society. We have the Parents Handbook that we teach a family how to look after from 0 to 6, from 6 to 18. So we have all those materials and we are putting videos, we are putting so many things out. And I'm really happy because the program that we have at CESTA, we are doing it in collaboration with 25 hospitals in each geopolitical zone, the major tertiary hospitals. So we are working together. So this news we had. So that means we can enroll all our patients in the registry to the National Health Insurance Fund. And then they can have access. This is really amazing. I'm really excited, honestly, because it's like we've been working towards this. We've been working towards it and say, we hope that one day there will be help. So the help has come.
Now, let's turn our attention to hydroxyurea and its usage so far by some healthcare providers and the experiences of sickle cell warriors who have adopted hydroxyurea as part of their management strategy.
Well, the most important thing really about this program is the fact that it's bringing the use of hydroxyurea in sickle cell disease to the fore. It's bringing it to making us aware of the fact that hydroxyurea is a disease-modifying agent that has the capacity to improve the outcome of people that have sickle cell disease. And I was just sharing my clinical experience on the use of the drug in sickle cell disease in our environment. Because usually the stories that we hear is that we're a third world country, we're a low-income country, we're unable to utilize this drug effectively. That's why I thought to share my experience. So the experience that I've had with sickle cell disease, which is the same with most of my colleagues among children, is that has been a very good drug that when it is used judiciously as should be used, has the import of improving the outcome of people that live with sickle cell disease. It helps to reduce the complications, the rate of complications, the rate of admissions, the rate of blood transfusions, and it helps to reduce the risk of them having strokes, people with sickle cell disease having strokes, which to me is one of the most devastating complications of sickle cell disease. So the drug has been wonderful when it is used judiciously as should be used in improving the outcome of people with sickle cell disease.
Sickle cell warrior, like sickle cell hasn't been an easy busy towards me. It's something that is very difficult, something that I won't wish for my enemy to have it. Due to the fact that in terms of drugs, our drugs are very expensive. In terms of relationship, at times due to sickle cell, we get people that won't want to date us for sickle cell. And even if you get to date the person and the person loves you, but the family members will be like, no, they don't need a sickler in their family. Aside that also, in terms of job opportunities, like now, I've worked in schools, I've taught in schools, I've worked in some companies. But the moment I break down, like let's say for like 2 weeks, 3 weeks, and I get back to work, they will give you some languages, but deep down they don't want to tell you that it's because of your health. They don't want you to continue the job. But in abroad now, for example, at abroad, they take their sickle cell warriors very important. Like they carry them like egg. They treat them like egg. They have free medical facilities. They have free drugs. They have free texts. They have free drugs. They have free tests. They also have different things that are free. Even job opportunities are very easier for them there than we in Nigeria. They have more opportunity to get job than we in Nigeria also. So also, in terms of, there's a lot of people, they don't have parents or assistants to assist them for their drugs also. So we are imploring the government and NGOs, if they can help us, they can help we sicklers in Nigeria to like get our medication at a cheaper rate and not on a high side. Aside that, like, how will I put it? In terms of like on a high side, currently the last time we had our World Sickle said they have a cure for it. They have a cure for sickle cell. But when I messaged them, they were like, it is 41 million. 41 million, a normal average citizen can't afford it. But abroad, I'm sure they are making it easier for their people. But if Nigerian government and NGOs can make it easier for us, especially with the bone marrow transplant, we really like it. Though our caregivers at University of Abuja Teaching Hospital, they are really trying. In terms of the care team, the nurses, they are really trying. Hydroxyurea is a very nice drug. It helps a lot. The moment you take it, it helps, like the frequency of you getting sick. The frequency of you getting sick is lesser, it's minimal, it's not much. like when you are not taking it. So I advise people to get to start hydroxyurea. It's a very nice drug. It's a very nice drug. Also, sickle cell have some kind of complications. We have stroke, leg ulcer. At times, there's a lot of things that come with sickle cell, and it's not easy at all. It's not a journey that is easy.
Well, my journey has been very, very, very difficult, and at the same time, somehow normal. Well, as a sickle cell or as a warrior, we do face a lot of challenges. Most especially the less privileged that don't, like, they're the ones that suffer it the most, because most of them, for the clinic, the drugs, they find it very difficult to get those drugs. So it's really been one of a hell. It's not easy at all, especially the pain. All of us face the pain. Most of our parents are so ignorant. They don't know what we pass through, the pain we feel. It's like, at times we feel like just giving up when the pain comes. But at the end, we thank God and everything gets back to normal. For the drug hydroxyurea, it's been really helpful. I've been using it for some years now. Yes, I've been using it for some years now. And I can tell, I testify that yes, it's really working. It's really, really working. Because I'm a warrior. And it's been years now, I don't have crisis. I don't have crisis at all. Yes, because of the drug. Since when I started using that drug constantly, I don't break down. But the only problem we have now, or I have now, is the drug not being available. It's not available all the time. So that is why we are asking our governors, governments to support us for the drug to be always available, because it really helps us a lot. The cost of the drugs is it's too high, and most of us are not able to afford it. Like, I don't know for the present price, but before the reload is 60K, hydro is 5K now. It's 5,000 naira. But then, when I heard about the drug, it was 3,000 naira, which was much more affordable. But now it's not, because of the high price of the drugs.
Well, there you have it from the horse's mouth. Those who have had to go through this condition all their lives. Let's now take a look at a couple of facts about hydroxyurea therapy. Availability and affordability of any medical intervention for any condition is key. Hence, you heard a while ago the challenges of the sickle cell warriors. Awareness creation is crucial. The importance of educating the public about hydroxyurea and efforts being made to build the capacity of healthcare service providers in administering the drug. Let's hear from some experts about this perspective and their thoughts.
Contacting sickle cell patients and then just having a groundswell of evidence that showed that Nigeria was the best place to do this work. Number two is the fact that Nigeria has its own homegrown source of hydroxyurea, unlike many other countries. And number three, the sickle cell population in Nigeria is by far the largest in any other African country. Those three things just make a significant microcosm of why this research should occur in Abuja and at this time. We saw that the first barrier to scaling up was making sure that physicians could provide this and making sure that physicians were well trained to provide this and felt comfortable providing hydroxyurea. We feel that by addressing healthcare providers, which are the gateway, it will start to scale up the adoption of it, and then it'll make it more accessible, number one. Number two, I think many of our guests, including from the federal ministry, have shown that now, in terms of access and care, individuals with sickle cell disease can access the National Health Insurance Scheme, which I think is a significant movement in terms of providing care for individuals with sickle cell disease in Nigeria.
There's the need for us to have more interactions with our colleagues as healthcare providers on the use of the drug, on how to use the drug, how to monitor the drug, when to give the drug, when not to give the drug, for example. There's the need for us to have more physician education, more healthcare provider education, and this is something that I must admit we're still deficit in. But there's quite a lot of people that have this knowledge as is required for the use of hydroxyurea. Particularly in the tertiary centers, the use of hydroxyurea has practically become like a norm for those who can afford it and where it is available and accessible in sickle cell disease.
We are the only company presently that manufactured Oxyurea, which is a brand of hydroxyurea in management of patients with sickle cell disease. And in terms of the production in Nigeria, production generally, because of the cost of inputs, raw materials, packaging materials, that one has actually affected the increase in price of products because most of these inputs are imported. And because of the Naira-dollar exchange rate, that has affected the price of pharmaceutical products or medicine in Nigeria. But as Bond Chemical Industries Limited is concerned, we are doing everything possible to ensure that we make our products available and affordable. And it has been proven that our products are high quality brand and they are very safe. We are doing everything possible to create more awareness for our own brand of Oxyurea, which is a brand of hydroxyurea among doctors, pharmacists, nurses, and other healthcare providers. And through that too, a lot of people or a lot of patients also have access to the products because the Oxyurea itself is a prescription product. It has to be prescribed by a doctor, and then the patient has to go for it based on prescription from his prescriber. Therefore, we are using every channel to ensure that the products are available, and then we have distributors, pharmacies, pharmacy outlets, major pharmacy outlets in Nigeria. They have our products, and then we also sell our products to hospitals and institutions. And these ensure that products are available and are accessible to patients at every point in time. Definitely through the health insurance scheme, the patients or the warriors will have more access to the products because when they register with the health insurance organization, they will definitely they pay a token, and then anytime they need the drug, they can easily access it through the health insurance scheme that they are already participating in. I believe that it's going to help a lot in ensuring that the patients comply with the treatment and then comply with the prescriptions from their doctors and prescribers. Definitely we have a price regulation because we have the price that we supply to our hospitals and institutions, and there are standard prices that they are to sell our products.
It is evident that efforts from experts, local manufacturers and awareness campaigns are crucial in ensuring a better quality of life for those affected. Remember, knowledge is power. Stay informed, stay healthy. This is Healthy Living and I'm Aisha Salihu. Until next time, see you again.